Hi and good day to our lecturer, Associate Professor Dr. Fu Leng Huat. We are from Group 1 will be presenting our finding of the study on the assessment of 3 days past 24-hour dietary recall on the risk of abdominal obesity among Muslim students staying in university hostel during fasting months. So let's check it out.
On 18 March 2020, Malaysia started enforcing the Movement Control Order (MCO) as a protective step in response to the country's COVID-19 pandemic. Students of University Science Malaysia, Kubang Kuan, also were affected as they were not allowed to travel to their hometown and restricted from going out from the hostels. Thus, Muslim students performed the fasting month in the hostel. They obligated to fast from the dawn to sunset with the abstinence from food and drink. Their dietary intake was affected due to the changes in social environment, food availability, and other possible factors due to MCO and fasting. Eating more calories than the body uses will produce a positive energy balance, causing fat deposition and weight gain. Eventually, this will lead to overweight and obesity. Overweight and obesity are defined as the abnormal or excessive fat deposition which could cause health problems. Although overall obesity presents a serious threat to individuals' well-being, body fat distribution is also a considerable significant in assessing this threat. Abdominal obesity is well known as central or visceral obesity, refers to fat mass of abdomen. Abdominal obesity is defined as a waist circumference of more than 90 cm in men and more than 80 cm in women. Abdominal obesity was strongly linked with several metabolic conditions such as type 2 diabetes, cardiovascular disease, cancers, and total mortality. In this project, we are using waist circumference and the 24-hour dietary recall method to assess the risk of abdominal obesity among Muslim students staying in USM hostel during the fasting month while obeying the Movement Control Order. Waist circumference is the most widely done as indicator for abdominal obesity and was identified as the best measure to be used. The 24-hour dietary recall method is among the most widely used for food, energy, and nutrient intake tools in nutritional epidemiology. In a decade, and assess energy intake assessed from the 24-hour dietary recall in a certain duration can be used to estimate the weight changes in individuals. This study was conducted on 15 students for 3 days of 24 dietary recall, and their waist circumference and weight were measured on the first day. We have 3 objectives of this study. The first one is to assess the risk of abdominal obesity among the Muslim students staying in USM hostel during the fasting month with MCO enforcement. Second, to evaluate the effect of changes in dietary pattern due to fasting and MCO among the students. And third, to identify the factors that can increase the risk of abdominal obesity during the fasting month and MCO period.
So for this study, it was conducted in order to investigate the risk of abdominal obesity among Muslim university students that were staying at the hostel during fasting month. And it was done during the lockdown seasons of COVID-19 pandemic. So the target population consists of 15 health science students of University Science Malaysia Kubang Kelantan, and they were voluntarily selected for this study, age group between 20 to 31 years old. So the procedure were conducted at hostel cafeteria for male participant and room-to-room visit for female participant, and the session lasted approximately 15 minutes each. So for dietary data collection, it was taken by interviewer administered 24-hour dietary recall for 3 consecutive days from 29th April until 1st May 2020. At the first day of dietary data intake, it was taken via face-to-face interviewer, but for the next 2 days, data intake was taken by phone call because it is more preferable by the participants. Next, for anthropometric data, It was taken during the first day of face-to-face interview by using basic home weighing scale and measuring tape for waist circumference measurement. Height was self-reported by the participants, and they are ensured to wear light clothing and remove shoes during measurement, and the reading was taken twice. Participants' physical activity level were assessed and identified to be sedentary because due to lockdown season, outdoor activities are restricted. So all the data was recorded by note-taking, and measuring procedure were taken with consent. Dietary data evaluated using Nutritionist Pro software system by ASIA, and the mean percentage for each nutrient for the 3 consecutive days were calculated. So for anthropometric data, it was used to calculate their total daily energy expenditure by using Harris-Benedict equation with physical activity level of 1.2, and the mean total daily energy expenditure for 3 consecutive days were calculated. Then, overall data were interpreted by using graphical data charting in order to view the targeted population overall dietary intake, and it was based on recommended nutrient intake guideline.
From the dietary assessment conducted, which was by 24-hour dietary recall, we have found that 33.3% of the students, which is equal to 5 out of 15 students, exceeded recommended requirement intake for kilocalories according to their total daily energy expenditure, and 66.7% of them consumed lower amount of kilocalories than their total daily energy expenditure. 33.3% of them also consume higher amount of carbohydrates than the dietary recommendation, which is within 45% to 60% of their total daily calories or total energy intake. In the meantime, 20% of the students exceeded recommended range intake for fat, which is above 35% of their total daily calories, which may be associated with increased risk of obesity. For the fatty acids consumption, 53.3% of the students consume more than 7% of their total daily calories for saturated fatty acid, and 13.3% of the students consume more than 1% of their total daily calories for trans fatty acids. Meanwhile, 73.3% and all of them did not meet the recommended range intake for polyunsaturated fatty acid and monounsaturated fatty acid respectively, which may also be linked to obesity. According to the graph shown, majority of the students did not meet the recommended intake for most of the macronutrients, which are vitamin C, phosphorus, iron, calcium, and potassium. 20% of the students exceeded the tolerable upper intake level of sodium, which is 2,300 mg per day, and 40% of the students consume more than the recommended intake for cholesterol, which should be below than 200 mg per day. Meanwhile, for anthropometry measurements, specifically waist circumference that has been performed, indicated that all of the male students are below the male's cutoff point, which is 90 cm, whilst for female students, 60% of them are below the female's cutoff point and 40% of them are above the cutoff point, which is 80 cm. These cutoff points are based on Asian classification for waist circumference.
Based on 24 hours diet recall, none of the participants had their total intake of energy according to the requirement intake that based on total daily energy expenditure. Most of them had lower calories intake as the meal frequency decreases during fasting. Based on the result, 33.3% of the participants exceed the recommendation of carbohydrate intake, while 66.7% are within the recommendation. However, excessive consumption of carbohydrate alone does not cause increase in risk for obesity if more fiber are consumed, but none of the participants had eaten enough dietary fiber. Majority of the participants consume adequate protein. Adequate consumption of protein will not lead to excessive energy as their total energy intake is below total dietary energy expenditure. 20% of them had excessive fat intake. Besides, 53.2% of them had high intake of saturated fatty acid and 13.2% of them had high intake of trans fatty acid, as some of the participants consumed more fast food during the MCO. 60% of the participants had low dietary cholesterol, which is below 200 mg. However, there is no association between overconsumption of cholesterol and abdominal obesity. Besides nutritional status assessment, anthropometric measurement, which is waist circumference, is also being used to measure the risk for abdominal obesity. Based on data obtained, all male and majority of female participants had waist circumference below the cut-off value, which indicates lower risk for abdominal obesity. During this pandemic had changed the lifestyle of an individual and made them be sedentary, increased food intake and had unhealthy diet. However, overall findings of this project shows that majority of the participants have lower risk for abdominal obesity during fasting month due to reduced energy intake despite the pandemic situation.
There are several implications of study finding to the targeted population. First of all, the 24-hour diet recall provides a detailed significant indications of a person's diet over a specific timeline. This allows us to identify the dietary patterns of the participant. For example, the results show 33.3% of participants consume calories more than their total daily energy expenditure, or also known TDEE. If they consume excess energy over a long period of time, they would develop the risk of getting obesity-related diseases such as coronary heart disease, hypertension, diabetes, and also cancer. Besides, 20% of participants exceed the acceptable macronutrient distribution range for fat. Fat are dense with calories, thus it is easier to increase the TDE while consuming high-fat food, which also lead to weight gain. Other than that, 53.3% participants were reported taking saturated fatty acid exceed the recommended, which should not exceed 7% of total energy intake. This dietary habit of high in saturated fat can contribute to total cholesterol and tips the burden to more unhealthy lower density lipoprotein cholesterol, leading to blockage in the hearts and throughout the body. Next, 40% of the participants were taking cholesterol exceed the 200 mg. As excessive dietary cholesterol intake is commonly linked with increased saturated fatty acid and reported increased LDL cholesterol and CVD. Thus, they might face these types of side effects if they do not reduce their intakes of cholesterol and also saturated fatty acid. In addition, the result shows that 40% of female participants were reported having waist circumference more than 80 cm, while all male participants has waist circumference less than 90 cm. This might be because of the number of female participants, which is more than the male participant. Exceeding this cut-off points indicates some health risks related to obesity such as diabetes mellitus, cardiovascular disease, and body mass index independent mortality. Last but not least, the implementations of public health initiatives in encouraging healthy behavior, including increased physical activity, healthy diet options, and avoiding weight gain for adults are important to reduce the risk of abdominal obesity, especially for university science major students. First of all, multiple-based 24-hour diet record provide detailed, quantitative information on a person's diet, especially on the foods and drinks eaten over the past 24-hour period. It is relatively low in respondent burden and short times interview is needed. Thus, this method is the most preferable among the students, which are more likely to join a study that do not burden and take too much of their time. This method can be applied to low literacy population and can be administered by interview, through face-to-face or through phone call that are more favorable by the young age population. However, 24-hour diet record is also exposed to some degree of error that can influence the values of the population's dietary intake data. Based on our project, we only managed to carry out 24-hour diet record for 3 consecutive days. Therefore, in the future, the numbers of days recorded for dietary intake must be enough to reduce the intra- and inter-individual variability effect. Several studies suggest that to increase validity, multiple 24-hour diet record can be done at least up to more than 7 days of assessment, including the weekend, depending on population and specific nutrients of concern. Due to possibility of recall bias when the respondent might cheat on their food item, it is advisable to not inform the respondent about the exactly date and times of the implementation. Applications of the portion size comparison guide explained at the beginning of the study or through dietary interview, such as use of egg, for example, food protogal is also recommended. Next, anthropometry measurements was used to indicate nutritional status. According to World Health Organization Step Surveillance Manual, waist circumference is measured by using measuring tape at the midpoints between the lower margins of the lower strip that can be palpated and the highest points of iliac crest during the ends of normal exhalation. This shows that waist circumference is easy to conduct and does not involve expensive equipment, as the participants were only required to stand with their feet but in a relaxed arm positions while breathing normally. Since this assessment was carried out during the movements control of the period, the height measurements was obtained through self-report. Thus, for a better measurements in the future, suitable tools such as steadometer need to be used.